On today's Two on Your Side Town Hall, we're talking vaccines with a whole new group of kids about to be eligible to get shots. We ask an expert what parents should know.
Plus, stopping the calls. We continue our robocall series with a heartbreaking story that will really put into context just how damaging the scammers can be.
And that gas pipeline cyber attack and shutdown led to long lines down south and even some changes for airline flights. We're going to talk to an expert about the impact in our area.
And good evening, everybody. We're glad you're here with us. We're going to start tonight with the FDA's decision to expand the emergency use authorization of the Pfizer vaccine to include 12 to 15-year-olds. So we're, of course, wondering what happens now.
And here in New York State, the soonest that age group could be able to get the vaccine is this Thursday. So that's because the CDC's Vaccine Advisory Committee and the Advisory Committee on Immunization Practices are both scheduled to meet tomorrow to review the data and make a decision about whether to recommend the vaccine for 12 to 15-year-olds. But it seems at this point like a foregone conclusion.
After those two committees meet, New York State's Health Director Dr. Howard Zucker and the state's Clinical Advisory Task Force will then make their own recommendation for New Yorkers. Again, that could happen as early as this Thursday.
And joining us live right now to provide some insight is Dr. Nancy Nielsen. She's Senior Associate Dean for Health Policy at UB's Medical School. She also leads the planning team for vaccine distribution in our region. Thanks again for being with us tonight, Dr. Nielsen.
Glad to be with you, Kate.
So let's start with that kind of general question. What do parents need to know, I guess, first about the process and the data that we're now getting from Pfizer and how well the Pfizer vaccine works in these 12 to 15-year-olds? And then also not just process, but practical. Is it safe?
Well, first of all, it's very safe and it's extraordinarily effective. In the kids in the trial of the 12 to 15-year-olds, not one single person got sick with COVID. Compared to about 18 in the placebo group. So, I mean, that's an extraordinary number. It's exactly the same vaccine, exactly the same dose as adults are getting. So parents should feel very comfortable with this. It's not like it's something new that their kids are being exposed to. Now, there are trials in younger kids going on now, and they used smaller doses. But by the time people are 12, they have a pretty good body mass, and so they use the adult dose. It's very effective, very safe, and frankly, this is one of the best pieces of news that parents of kids in junior high and high school can get, because it'll get kids back to school, back to living normally, and being able to do a whole lot of things they haven't been able to do.
We've seen vaccination rates in the region slow down, and partly because people are getting vaccinated. More than 60% of the eligible population in Erie County now has already received one dose. So how much of a difference is expanding eligibility to this age group now going to make?
It is going to make a difference, Kate, because you know, it's the total population of people who are still susceptible that we worry about. And there are 17 million kids in that 12 to 15 age range. And the more we get vaccinated, the better. It will certainly get us all to close to herd immunity, at least in most parts of the country.
Dr. Nielsen, Erie County is currently outperforming the state of New York and most other states around the country, getting more than half of the total population now with at least one dose of a vaccine. But the other counties in Western New York, we've talked about this a lot, they're not doing so well. In fact, Allegheny County has the lowest percent of population with at least one dose in the entire state of New York. I wonder what new insight can you provide to us on what's happening there and what the vaccine hub is doing to try to improve those numbers in our more rural counties?
Well, the people who are the boots on the ground here are the local health department, particularly in all the counties, but in Allegheny County. They used information that was provided by our information guru, Natalie Simpson, and others to find out where people lived who still needed to be vaccinated. So they have already made plans to go. They have 3 different areas they're going to. And remember, there are different categories of people who haven't gotten vaccinated. There are people who still don't have access, and that could be because of where they live, or lack of transportation, or they may be homebound. So there's that category. Then there's the people who they'll get it, but it needs to be pretty convenient. It, needs to kind of fit into their life. And then there are those who are just not interested, and that's the toughest group. But I can tell you that all of the counties, including Allegheny, are working very hard to reach the people who want vaccine but haven't had access.
With more people starting to get vaccinated now, we're starting to see things move a little bit more quickly, and we're always getting a lot of questions, Dr. Nielsen, from our viewers about whether or not they need to wear masks outdoors. There have been some recent studies and reporting about how infrequently the virus spreads between people outside. What is your recommendation for our viewers on this? When do you wear a mask outside? When is it okay to maybe not to?
A fully vaccinated person, 2 weeks beyond the second shot, if it's a 2-shot deal, they can go without a mask in small groups of people who are fully vaccinated, or some kids who aren't fully vaccinated yet because they haven't had access. But if you're in a crowded space, even, if you're at a concert and there's a whole bunch of people there, you really want to wear a mask, even if you're vaccinated. This is just the wise thing to do. I think we really have to be careful when we're in either closed spaces, but outdoors, it would just be in a crowd.
Dr. Nielsen, we have about a minute left, so I'm going to ask an unscripted question here because I keep getting this from people who are hesitant of the vaccine or maybe believe that these vaccines haven't gone through the scrutiny that they think they should have. What would you say to the person out there who's watching who says, why would we put these vaccines in 12 to 15-year-olds when their chances of getting really sick are so small? We know kids do a lot better with this disease. What would you say to them when they argue that, we haven't done long-term safety testing on these vaccines because we haven't had them for the long term?
Well, we've had the technology. The technology's been developed over 20 years, to be honest. It's true that we haven't had a vaccine with this mRNA technology before, but it's been studied widely, and it has been used in trials for Ebola and a whole bunch of other corona-like viruses. So it is actually safe. But here's the big issue, Michael, and that is while kids themselves may not get so sick, a lot of them are getting infected. It's estimated, the American Academy of Pediatrics estimates that 25% of the new cases are in kids, and they can bring it home and spread it to somebody who's very vulnerable. Big message, kids need to get back to school. Everybody needs to get vaccinated. Then everything goes back to normal.
That's right. Safe and effective. I'm so glad you were able to address that because we've heard it from so many people. Dr. Nancy Nielsen heads up the planning team for vaccine distribution in our region, among many other jobs. I know that you're a busy woman. Thanks for taking some time.
Thank you. Take care.
Always appreciate the insight. Now we continue our Town Hall's week-long series called Stop the Calls, an effort to fight back against robocalls. We know they can be annoying, and 1 in 6 American adults loses money every year from these phone scams.
Yeah, that adds up to $10 billion a year, essentially stolen from people. But as we're about to see right now, for some families, the cost goes way beyond just money.
My grandmother was targeted and pursued nonstop by a ring of fraudsters.
Robocallers targeted 82-year-old Marjorie Jones.
We found hidden in a closet several bags full of wire receipts where she had been sending large sums of money overseas.
Her granddaughter, Angela Stancic, testified before the U.S. Senate.
It was a 10-person ring in Costa Rica. It was a call center. They posed as representatives of the U.S. Security and Exchange Commission and also the FTC, and using call spoofing technology.
Spoofing tricks people into believing the call is coming from a specific location.
The last phone call I had with her, she was extremely adamant about needing this money. It also cuts me to my core that I didn't stop everything that day and go to her.
It pains me to talk about my grandmother's horrific death, because she chose to take her own life. My grandmother died with $69 in her bank account.
They were able to find the ring in Costa Rica. The two ringleaders involved got close to 25 years in prison. They took my grandmother's life. They had blood on their hands.
It's Angela's mission to help other families hold robocallers accountable.
Reach out to your elderly loved ones and your grandparents more, be more involved, and get in their business, check their mail, check their caller IDs.
Americans' phones still receive 125 million robocalls every single day.
Right before the start of the pandemic, we tracked them down.
It turns out they don't like to be contacted by strangers either.
And on that note, you do not want to miss the town hall tomorrow evening. Our next story in this series, called Stop the Calls, will feature one of our investigative reporters going and confronting some of those robocallers.
And in the meantime, we do have extensive coverage on all of this online at WGRZ.com/robocalls. And we were just talking about how heartbreaking this story is, but that it certainly can't be the only story.
Yeah, these calls aggravate us. That story should make you furious.
Yeah.
I mean, that just takes it to a whole different place.
Yes.